Senator, Congressman, my colleagues and friends from across these United States of America working on health care. Often when I meet with groups on health care, I start with, who here wants a bad health care plan? And you hear crickets. People don't want a health care plan. People want a good health care plan, but they want one that costs less. That's what they want. That's what the people want. That's not what they're getting. And so we've been working in Connecticut to deliver that. And we found something very basic. As a congressman said, by pulling people together, we can have a good health care plan that costs less. We passed legislation, the Connecticut Health Care Partnership, which opens up the state health care plan, which is a good plan, which as legislators, I'm on it. It opens it up to cities and towns, small businesses and nonprofits. And as we traveled the state of Connecticut, we compared plans, and cities and towns said this plan is as good or better than the plan I have, and it costs less. Businesses said this plan is tremendously better than the plan that we have and costs tremendously less. Why doesn't it make sense to have a public health care option available to businesses, individuals, so they can have a good health care plan that costs less? There was one instance where we were sitting down with some small businesses, and there was an insurer there, and the insurer was trying to talk the small businessman out of this plan. Oh, it won't work, etc. And the businessman says, look, I'm a small businessman. I make choices every day about my business. I know what's right for my business. You give me your plan, and let that representative show me his plan, and let me decide what's right for my business. That's plain talk, and it's right talk. And that's what we're working on, and we're thrilled that Congress is working with President Obama to work on this public plan as well. You know, we have a saying in Connecticut, you know, now that we have a new president, that when it comes to health care, we have great hope for what happens in Washington, and we want to be Obama ready. We want our state to be ready to go so that we have the structure in place, so whatever happens in Washington health care, we're there. So we can provide that health care to the people in our state instantly. So we passed another bill called the Sustenance Plan, and a lot of the advocates worked out here that said, okay, besides opening up that pool, which will save the state millions of dollars, hundreds of millions of dollars, save everybody else hundreds of millions of dollars, help growth in our economy, we'll also have this group of professionals and practitioners and experts that come down and say, okay, how do we use that as the model to move for whatever happens on Washington? What do we do to ensure quality of care? What do we do to make sure that those current practices are being done? That work is also in that sustenance plan. So we will be Obama ready for any plan that comes out. These are two models that we've done in the state of Connecticut. And we are thrilled that the federal government is working on this, and we're looking for a partnership. That's what the people want from government. They want to have a partnership. And I'm thrilled to be here with my colleagues, 700 plus, who are saying to our congressional senators and House members, we are your partners back home. When it comes to health care, we got your back, and we're hoping for the best, and we'll work with you to have a public option and health care for everyone. Thank you very much.